watching Louisiana Living with Ashley Dowdy on Fox 14.
And welcome back to Louisiana Living. I'm here with Dr. Hardy Gordon with Louisiana Pain Care in Monroe, and we're talking about neck pain. Dr. Gordon, thank you so much for joining us
Yeah, thanks
today.
for having me back.
I saw an alarming figure. A whopping 80% of adults suffer from neck and back pain. Is that because that we're sitting in front of the computers more, we're not moving around or on our phones?
That is contributing to it. I wish I had a perfect answer, so therefore we could maybe stop it. But what we are seeing is that at least 2/3 of Americans are going to have some type of neck pain, and the hope is that it doesn't turn into chronic pain longer than 6 weeks. As we discussed previously about back pain, that is about the same 80% as well. So what we're seeing is that there's multiple reasons to have problems in the neck. One of which is muscle, one of which is cervical discs. The other would be bone and nerve. And my model here shows we've got 7 cervical vertebrae, and in between each vertebrae is a disc, which unfortunately can become a pain generator. The cervical discs are basically there for shock absorbers and also to provide movement. What we typically find is in the lower part of the cervical spine is where we have the majority of the movement, so therefore we can have most of the problem in that area. The discs have a lot of nerve endings in them, and they're also very close to the nerves which which provide sensory as well as motor function of the arms. What we can see is oftentimes people will develop either cervical disc herniations or some type of degenerative change, and it drives inflammation. It's a confined space by design for protection, but whenever you have inflammation build up, it only breeds more inflammation. It'd be like if I invited 1,000 people in this room to try to figure out what was wrong with you. It's only going to upset you even more. So what we do at Louisiana Pain Care is we provide directed therapy to where we put medicine in where it needs to go to decrease that inflammation. We can also do that for the smaller joints, the facet joints on the backside, which can certainly cause axial pain. We can also provide occipital nerve blocks, which cervicogenic migraines, people have a lot of headaches in the back of their head. Along with all this, you have muscles which can ultimately get tight and taut, and so we can send people to physical therapy or provide trigger point injections where we go in and try to release some of that muscle spasm.
Are the results pretty immediate with the injections?
They are. We have patients come in as an outpatient procedure. They have to have a driver because they're going to get a lot of sedation, so they don't remember the procedure. Nobody really likes to think about having a needle in their neck, but it is very safe. It's almost painless. What we do is we numb the skin up, small needle goes in, deposit the medicine. The procedure literally takes about 5 minutes, and then they go home. They typically feel better over a day or two, and then hopefully the pain doesn't return. If it does, we're there to provide relief again if need be, and it's certainly not a permanent surgery, which oftentimes cannot be guaranteed to provide complete pain relief as well.
How can someone get an appointment with the doctors at Louisiana Pain Care?
Well, you can have your primary care doctor give us a call, or you yourself can call at 318-323-6405, and we'll get your records in and see if we need to order any tests and whatnot and try to get relief as quickly as possible.
All right, Dr. Gordon, thank you so much for coming on the show. We look forward to having you back.
Yes, anytime.
We'll have more Louisiana Living after the break.